Hello there, this is Dr. Dawn Marcus. I'm a pain management specialist and a professor at the University of Pittsburgh. I'm also the author of Therapy Dogs in Cancer Care, a valuable complementary treatment. This book encourages you to think about adding a dog to your cancer management team. This may sound a little silly, but interestingly, there's a lot of research that shows that adding a dog to your team can decrease your patient's pain, anxiety, and sense of isolation and loneliness. Improving those symptoms is important for improving quality of life and also for enhancing cancer survivorship. One of the other things we talk about in Therapy Dogs in Cancer Care is how dogs cannot actually be cancer detectors. When I first heard about dogs sniffing out cancer in their owners, I confess I was pretty skeptical. But I heard stories from a variety of people that really sounded time and time again the same. And we have one of those stories here in Therapy Dogs in Cancer Care that I'd like to share with you. Terry and Priscilla were in their mid-60s when they adopted a long-coated Akita puppy, Joy. All was going well with Joy's training until she was a few months old when suddenly her behavior changed. She lost an interest in playing, lost an interest in eating, and only wanted to be around Terry. And when she was around him, she would whine and repeatedly poke him in the groin. Recognizing something may be wrong and that Joy may be trying to tell them something, Priscilla wisely insisted Terry go to the doctor, where Terry got the unfortunate diagnosis of prostate cancer. Terry went through treatment, did well, and Joy's behavior returned to being a wonderful, happy puppy. A few months later, Joy's behavior once again changed. This time, she began to focus on Priscilla. She was poking Priscilla repeatedly in the buttocks, and Priscilla immediately went to the doctor, insisting she have a colonoscopy. I can only imagine her doctor's skepticism when he asked her why she needed a colonoscopy, and she said, "I have colon cancer. My cancer-detecting dog told me so." Well, the doctor wisely followed Joy's advice, did the colonoscopy, and sure enough, Joy was right. There were cancerous and precancerous polyps that were treated. Both Terry and Priscilla have gone through cancer treatment and today are cancer-free, thanks to the early detection of their long-coated, cancer-detecting Akita Joy. Well, what's going on with Joy sniffing and poking at Terry and Priscilla? Did they overreact to her poking and prodding behavior, or was there really something to it? There's been a lot of research looking at what's happening with dogs and can they really sniff out cancer? The answer is probably, and some exciting research looking at electronic sniffers. These are devices engineers have created to capture and analyze gases emitted by different tissues. These gases then form patterns, and those patterns are called smell prints. Different tissues have different smell prints, and healthy tissue, diseased tissue, and cancer tissue all have different smell prints that can be analyzed by computers, and apparently they can also be analyzed by our dogs. So when you're talking to patients about cancer, think about adding a dog to your cancer management team. Dogs can act as cancer detectors, and they can also act to enhance the quality of life for patients who are cancer survivors.